All right, you've probably heard all about them. Botox parties. Sounds great, right? Well, it may seem like a lot of fun, these social gatherings where you get this group discounted rate to get your Botox done. Well, there are some safety concerns over these parties, though. Board-certified plastic surgeon Dr. Hector Salazar Reyes is here now to talk with us about everything you need to know about the Botox party. Welcome.
Thank you. Thanks so much for having us here.
Do you know how unnerving it is to interview a plastic surgeon? The entire time I feel like, don't look away. No, in all seriousness. Okay, so let's talk about the Botox parties. They are definitely popular. I get an invite to one every month, but you said there's some concerns about that.
No, I totally agree with everything you've said. A party is a nice social gathering where sometimes, or most of the time, there could be some alcohol involved. And Botox is a medical treatment that should be administered by a licensed healthcare provider. And in terms of who can administer Botox, it has to be administered under the strict supervision of a physician all the time.
Not a nurse practitioner?
A nurse practitioner can inject Botox, but it has to be strictly supervised by a physician. Also, the other thing to talk about is the setting. Botox has to be injected in a medical office or a medical spa, not at a party in a house or even a beauty salon. Sometimes that happens.
So you're raising safety concerns then. If it's not done by the person who's legally supposed to in a setting
Correct.
where it's supposed to be, that means anything could happen.
Anything can happen. Part of any medical treatment, I think an essential part is the consent, the informed consent process in which the patient asks as many questions as they want. They get informed about the risk and benefits of any treatment, including Botox. A party where there could be alcohol involved takes away all that part of the process. So it's not going to be an informed consent. The patient is going to be under the influence of alcohol and cannot provide or give informed consent of a treatment.
And if you're drinking alcohol and you get procedures like this, doesn't that increase your opportunity for bruising?
100%. That's totally right.
All right. What about, I mean, anytime you go to the doctor, you fill out a questionnaire, you know, either things you like, things you don't like, a family history. In these party situations, I can't imagine there's necessarily too much of that vetting process that goes on.
Exactly. Your medical history is not going to be appropriately reviewed. Also, your concerns, your expectations. It's something that we discuss thoroughly with patients during a medical visit, during an office visit for Botox. The other thing, and I think this is really important for our audience to know, is that despite of the fact of Botox being a benign treatment with low risks, I said low risk. There can always be a risk of a complication. So the best setting to take care of that, it's at a doctor's office. And the other thing is to provide our patients with appropriate follow-up after the treatment.
What about the popularity of these? I mean, I've heard them before. It was kind of like, hey, there's a Botox party going on over here. But now they're all over social media. So it seems like they're rising in popularity, and that would, in my mind, have something to do with demand.
I totally agree. And the problem is that everybody wants to look good nowadays, right? We all want to look good. But we should never, ever sacrifice in safety. It is our body. It is our image. You have to go with a licensed provider and someone who has, number one, experience in injecting. Number two, someone who you can actually verify their credentials and that has a well-established office or medical spa where this treatment will be provided.
So it sounds to me like you're saying it may have a good discount, but then the payoff may not be worth it in the long run.
There could be a lot involved.
All right. Good to know, good to think about. Again, you heard all the questions, and this is coming from a board-certified plastic surgeon, so enter at your own risk, I guess, is the way to give it to the viewers, right?
And for our audience to actually do their homework and look for good, authentic, well-licensed providers.
Yeah, even though it's really common, we're still talking about a medical procedure.
100%.
Yeah, very interesting. All right, doctor, thank you so much.
Very good.
All right.